Good afternoon. Good afternoon. I'm Jenna Conway. I'm the Deputy Superintendent of Early Childhood and Care and Education here at the Virginia Department of Education, and very pleased to welcome everybody to our public hearing on supporting school readiness in Virginia, improving provider rates and parent co-payments. We are here in person at the James Monroe Building in downtown Richmond, Virginia, and we are also streaming statewide as this is a public engagement stakeholder session. We are making sure that all technical functions are working, including microphones, and we're good to go. And then I'll go ahead and get us started. I am also joined on the very formal dais this afternoon by key members of the Department of Education and the Department of Social Services team. And I'll take this moment and ask each to introduce themselves. Aaliyah, would you like to begin?
Good afternoon, everyone. I'm Aaliyah Lewis McKinley. I'm a policy analyst here in our Office of Early Childhood Access and Enrollment.
Good afternoon. I'm Rebecca Ulrich. I'm the Director of Early Childhood Access and Enrollment.
Good afternoon, everyone, and I'm Sherry Dorsey. I'm the Child Care Subsidy Program Manager with Virginia Department of Social Services.
Wonderful. With that, we will go ahead and get started with our content this afternoon. Before jumping in, I wanted to express on behalf of the Governor's Office, the Department of Education, and the Department of Social Services, tremendous appreciation to everybody in the field who's listening today, as well as some of our visitors who've come here to Richmond. This is a very important topic to both agencies as well as governor, and are excited to walk through some new proposals for childcare, both as it relates to rates that the state pays for childcare and what parents are expected to pay. We have a longer presentation. We wanted to share a bit of information with you all as that led up to some of the proposals and then walk you through the proposals. We will make all of these slides available as well as posting this online. I will go through all of the slides. We're not going to take questions as we go, but we'll hold time for questions and public comment at the end. So starting off, we'll begin with what brings us together, our vision and what we're trying to accomplish today. We'll talk a little bit about our most recent budget and how that has led to the set of proposals today. And then we will talk in detail about the two proposals. One that has to do with how the state sets rates for the child care subsidy program. And the second is how we set expectations for parent or family co-payments. But before jumping into the details, and there's a lot of information in these slides, I wanted to take a step back and talk about what brings us together, our work across childcare, Head Start, school-based early childhood programs. And basically, we share a fundamental belief that all children deserve the opportunity to come to school ready. We know, however, in Virginia that 42% of children are coming in lacking skills in either literacy, math, or those key social emotional skills, social skills and self-regulation. We know that these numbers are even more concerning from our children coming from low-income backgrounds and our children with special needs. And a part of this has to do with both access and quality. We know we pay much lower than other states, and we don't know a lot about the quality experiences that our kids are receiving. And all of this is in the context of a global pandemic, COVID-19, that has had a tremendous effect on the early childhood sector. Whether it's our family childcare, our school-based programs, the programs themselves, as well as the kids and families across the Commonwealth. With that in mind, it's important to note that we have to work together, all of our programs. There's no single provider birth to 5 that can serve all kids. And so although we're going to talk really specifically about childcare, rates for childcare, co-payments for childcare, it's important to note, and you'll hear us make references to programs like Virginia Preschool Initiative or Head Start, because we have to work together to make sure that all children have the opportunity to come to school ready. What this means to us is that families need affordable access, and we'll talk about affordability this morning, to support and choose the option that best meets their needs. What's really unique about our early childhood system is that we've got a public-private family choice system, right, that has a whole range of different providers and options, and it's really important that families have choices. We also believe that our programs that take public dollars should be prioritized and supported to improve day in, day out, making sure that no matter what an option a parent chooses, that it's a quality infant, toddler, mixed age, or preschool experience that puts kids on track for success. And in return for that, programs that take public dollars should receive sufficient resources to meet those expectations. And we'll talk a little bit more about that. But we envision a unified system, whether you want to choose Head Start or childcare, family childcare, or school-based program, no matter what you choose for your infant, your toddler, your preschooler, it's an experience that puts those children on track for success, because we know when kids have the opportunity to come to school ready, they do better in school and in beyond. And we have lots of evidence and data that suggests that. So with that, health deserves the opportunity to come to school ready. Let's talk what happened in this year's budget, because that's partly why we're here today. That's why we're having this public hearing. So there were a set of early childhood priorities in this budget that was signed just last week, but basically called for continuing to unify our system so we can speak with one voice here at the Department of Education in partnership with social services about health, safety, and learning expectations for all publicly funded programs, to make sure that we're continuing to focus on more access and choice, supporting the sector to continue to recover from COVID-19, and then ultimately, hopefully, building the nation's best public-private parent choice system with all of our providers. Again, it takes all of us working together. Specifically in this budget, there's a couple of key things that I want to highlight, because again, that's what led us to be here today. So there's more funding for some supports around quality. There's additional funding for the Virginia Preschool Initiative and our Mixed Delivery Grant Program that's run through the Virginia Early Childhood Foundation. That allows us to serve 3 and 4-year-olds in private settings, as well as an infant toddler pilot this year. We have we've doubled the investment in Recognized B5, which is that early child care educator and family day home educator incentive, up to $2,000 this year for programs that take public dollars, for the teachers that work directly for kids. And we've continued to expand VKRP. We have also, for the first time, at least in recent history that I can think of in Virginia, have a lot of language in our state budget about what we want to do with our federal child care dollars. And that's really important, because we have child care dollars that come in through the block grant, as well as child care dollars that have come in through some of the COVID response efforts. And this budget specifically says, and I'm not going to read every one of these bullets, but you can see on your screen at home, that there's a set of things that we're doing to make the child care subsidy program in Virginia work better for educators, families, and work better for kids. This means removing the 72-month limit. Right before, parents could only receive the program from 72 months, but many of you would say, but my kid needs aftercare up until age 12, right? And that covers only half of that. Supporting parents to pursue work, so recognizing job search as one of the eligibility criteria, paying programs based on enrollment and adding additional days of closure, knowing that we've had a lot of kids had to miss because they've got a quarantine or they're concerned we don't want kids coming to care when they're sick. Setting a higher eligibility, so 85% of the state median income for families with young children, working to eliminate the wait list, and what we're going to talk in great detail about today, so I've saved the best for last here, looking at the rates and redoing all the child care subsidy rates to address the true cost of quality, sort of funding programs to meet the expectations, and eliminating or reducing co-payments for families. So making it sort of more doable and financially feasible for childcare providers, and making it more affordable for families. So I should note before we jump into more of the weeds, please, if you do have the opportunity this summer as we go into election season, please thank your local elected officials. It was the General Assembly and this governor who approved this budget that has all this valuable language and basically allows the Department of Education, in partnership with social services, to put this in effect as of July 1st. It's like a little bit more detail. It doesn't all change on Friday, but really important. Your legislators need to hear from you. If you appreciate some of the changes that we're talking about today, let them know. Your voice in your community is very powerful. And as we've seen over the course of the last 2 years, Childcare is getting the attention it deserves in the media, but it's really important that your elected officials hear from you, partly to thank them for some of the changes they put in place, but also to continue to say, we need these type of resources to be effective, to be able to provide high quality experiences to kids and to ensure that parents, particularly moms, can return to work. With that in mind, what I want to do is take a big step back and say, okay, you've just talked about all these changes in the budget, but what is behind that? What is the reason for putting all these changes to the child care subsidy program in Virginia? In other words, why do we need all this change? What is broken about the current system? So I want to take a few moments. We needed to change rates before talking through for our providers, our leaders, our family childcare educators today. Work. It's called a market failure. It's largely smaller organization, mom and pop, family or neighborhood childcare programs that rely on private financing. Really means what parents can pay. We know that if you happen to make money, your profit margins are razor thin. Most childcare programs across the country operate on profit margins of less than 1%, right? So no margin of error. And in fact, half the providers in Virginia last year reported making no money or losing money, right? So it really, the market isn't working. And that's why when you open the newspaper, or you turn on the radio or the television, you hear about some parent on a wait list somewhere, because why would you want to get into a business when half of the companies or half of the organizations are losing money? Parents, on the other hand, have to pay thousands and thousands of dollars at a point in their lives and their careers when they can least afford it. There's not a lot of financing. I remember at a point when I had young children, my childcare costs more than my car, and I could finance my car, but there was no way for me to finance. I had to pay in cash every week or 2 weeks or a month. And as I'll talk about in a second, even though parents feel like they're paying way more than they can, more than their mortgage or rent, what our providers are saying is we are underpaying our teachers, but we can't afford a penny more for compensation, for resources, for supports. This gives you a sense of how expensive childcare is. Again, the average rate for infants is $14,000 a year, and for preschoolers, just under $11,000 a year across the state. If you look at in this chart, that means that if you, depending on where you're making, you could be spending almost half of your income on infant care, right? Most people aren't actually spending this, right? As a result of this, we have families either opting out of care, right? Staying home, scrambling to find friends, family, neighbors, not a stable experience for kids. And then in turn, opting out of the workforce and losing out on that opportunity to pursue greater self-sufficiency for their families. It does get easier as families have more resources, but what that creates is basically a pay-to-play system, right? Where families with resources in the Commonwealth can afford childcare, high quality childcare, and those families who lack those resources, their kids don't have that opportunity to have access to the experience that puts their kids on track for success. At the same time, you're like, oh my gosh, and I know every parent I've talked to who is paying for childcare is stunned and shocked when they understand how little those childcare teachers are being made. I just shelled out $14,000. How in the world is the teacher in that infant classroom only making $10 an hour? But we know, right, because of how labor intensive this work is, right? You cannot put 20 infants with one educator, that our early childhood teachers are making significantly less than any other teachers in the system. And as a result, they are likely to be experiencing some level of poverty or food insecurity, right? So it's this vicious cycle where parents don't feel like they can afford to pay any more. And childcare teachers are like, I can't do this work. I have to go work at Target, at Walmart, because I need to be paid just more. I need to be paid more. This is no one's fault. What we know about childcare, what we know about brain development, is that children learn in the context of relationships with live adults, right? And in order to keep our babies and toddlers safe, we have to have low teacher-child ratios, right? Much lower than any aspect of the education system. Higher education, community college, K-12, all of them have higher teacher-child ratios than our infant and toddler classrooms do. So staffing, even though teachers make so little, accounts for up to 70% of the classroom operating costs. And so a program says, I'd like to pay her more. I need to pay her more so she won't leave and go work at Target or Walmart or in the restaurant industry or Amazon. But then I, in turn, have to turn around and charge my parents more. And they're already paying $14,000 or $13,000, and they can't afford any more as well. And this all comes our market works, both in our state as well as across the country, is that we have set rates on how we pay programs based on what parents can pay. The market rate reflects what the parents or families in your community can pay, rather than what you need to do, what a provider needs to charge in order to meet expectations for health, safety, and learning. And that's a really important point. When you go to parts of our country where childcare is most affordable, oftentimes that has to do with what the private parents can pay. Like they simply can't pay anymore. So instead of responding to here are the expectations that we have to achieve and we're funded to meet those, what our private providers end up charging is their rates. And in turn, what the state uses to set its rate for the child care subsidy program really reflect what parents can pay, not what it actually costs to offer high quality childcare. So with that in mind and kind of that background or that kind of economic understanding of like how we got to this place and why we have to change the way that we fund programs, I'm going to give you kind of a sense of the two proposals that we're bringing to you today in this public hearing. So in order to have more kids come to kindergarten ready, we need to look at all of our children who are participating in the child care subsidy program and make sure that we're funding programs to meet the quality expectations that we're setting forth, and that we're making childcare more accessible to those families who are participating in the child care subsidy program so that providers can afford to participate and help kids make progress, learning development progress, and parents and families can afford to participate as well. We'll talk specifically about our new model for calculating the rates, so moving away from the market rates, because I just walked you through why those are a failure, why they don't work in terms of being able to help you meet quality expectations. So we're going to talk about using a cost estimation model. This is an innovative approach that we've been approved by the federal government to do to determine the true cost to meet our quality expectations with competitive compensation. So we'll talk a lot about how to competitively pay your teachers so that they can meet these expectations and that you can compete in the changing workforce. And we're going to talk about restructuring the co-payments to make sure that this program is affordable for families as well as for providers. So before jumping into the specific proposals for both the provider rates and for the co-payment restructure, we wanted to share our values or our principles that are guiding this investment. So we've started off with our shared vision. We got to make sure that we all work together to make sure all kids have the opportunity to come to school ready. We talked a little bit around why we need to change, right? Why the child care market rates don't work for families and don't work for providers. And we're going to put forth two proposals that will have a cost for the state, right? Will represent an investment. We think it's an important investment in the workforce. We think it's an important investment in families. And most importantly, it's a huge investment in kids, right? To help make sure that they have the opportunity to come to school ready. But when you think about investments, you want to invest in a way that aligns with your values. And so what I'd like to do next is walk you through, here are the principles that have guided the two proposals that we're going to present to you. So there's three key principles here. And what we're asking today is for you to kind of weigh in and say, do you agree with this, that these are some of the values or principles that we should use to think about increasing our investment in early childhood? So the first one is we want to make sure that our public-private system, right, that has a whole array of providers. Some of you offer full year, full day, full year. Some of you are part-time. Some of you are academic year. You're in a variety of settings, from childcare centers to homes to schools to churches to community-based action agencies. But that we should be able to, across our many options, offer true choice to families. And that means that families should be able to choose based on what makes the most sense for that child and that family, not just on affordability. We know right now that public school is free for pre-K, right? And we know that we should try for families that are eligible for free pre-K. How do we create an equivalent or pretty close to that for our private community-based settings? And we say across the board, we think our families that are below the poverty level, who are living in poverty, should not have payment obligations. We don't want a family living in poverty to be able to access Head Start and VPI for free, but then have to pay a lot out of pocket for childcare. That's point number one. We want true choice for families. Value number two, or principle number two, is we have raised the bar. I was just talking with some colleagues in the audience today about these higher quality expectations for programs that take public dollar. We understand why. We want to put every kid on track for success, and that means we need to understand what's happening in our classrooms, our settings, to support new instructional tools like curriculum. But we should fund programs to meet those expectations, and that means that we've established in Virginia all of our programs that take public dollars are going to be under VQB5, right, which sets out expectations around classroom observations and using curriculum. In turn, we need to align our public payment rates to support that, right? In K-12, we say, here are the standards of qualities, and we fund schools to meet those standards of quality. We need to take a similar approach in early childhood, while also recognizing what's unique about early childhood. And we want to make sure that our providers, particularly our providers in our private settings, our private businesses, or our community-based settings, have access to resources that support them to improve, right? This isn't a gotcha system. This is a system that says, how do we support you to improve the experiences across all of your classrooms every day, every year, and a continuous improvement cycle? We think a lot of this hinges on educator compensation, competitive compensation for all educators. This is the only way in which this sector can attract and retain competent early childhood teachers. And so we're going to talk and to peg the salaries and the kind of salary ranges. Well, always will remain, a private business will always have the ability to pay their teachers what they want to pay them, but to start to think of this as a proportion of what our public teachers make, right? Sort of moving it away from a minimum wage profession to something that we're understood as educators, as education professionals. And so we're working and want to work with the field, and we'll talk in more detail about how to do that, how we get to more competitive compensation in Virginia and the child care teacher workforce. Okay, let's talk a little bit about these values with a little bit more data to do. So I think the first one I want to talk about is that if we don't fund programs in the same way, and if certain families have greater expectations, it's not really offering true choice families, right? And so really looking at this chart presents, you see a huge range in the funding, both in terms of the kids served as well as the funding available. I will note that you'll start to see in our materials, and what we've really focused on is getting down to the hourly rate, and really thinking about all the hours that programs offer. If we just take kind of a K-12 lens or way of thinking about things, you really think about 990 hours a year, 180 days. That doesn't work for working families, right? I'm able to be here today because my 4-year-old has summer programming at his childcare school, right? Otherwise, I wouldn't be here. I'd be, dealing with somebody in the background. So what you see on this chart, you might say, well, wow, it looks like certain programs get more dollars, right? So the mixed delivery program, for instance, is a greater amount per kid than, say, Virginia Preschool Initiative. But when you break it down hourly, what you actually see is per hour, we pay a little bit more for the Virginia Preschool Initiative than we do for the mixed delivery program, right? Because one is about 990 hours. The other one is more than twice times that. When you start to think about what does it really mean to cover 7 a.m. to 6 p.m., right, to support the working families in your community. And you'll notice, again, when you use that methodology, the lowest paid program right now is our child care subsidy program, coming in at just under $3.50 an hour. So that doesn't feel like true choice when you have those disparities. It also doesn't feel like true choice when you look at the difference between what families have to pay. And so there's a lot of numbers on this chart, but if you look at the column underneath CCSP, what you see is the expectation of what parents have to pay or had to pay for co-payments under our current regulations. Right now, thanks to the pandemic, we've had a pause on that for the last 2 years, which has been huge. Now, the federal government, we'll talk a little bit, does require co-payments, but what you see is for a family at particularly that upper income, they'd be eligible for mixed delivery or Virginia Preschool Initiative, and they'd be zero cost there. But if they wanted to go to the private program within their community that's meeting those very same quality expectations, they'd have to spend over $4,000. Or in the case of our families that are coming on now with our expanded eligibility, nearly $7,000. That's a huge difference for families and doesn't really represent true choice. If you can't afford to pay that copayment, it really sort of means that you don't have choice. So figuring out how we resolve that is really important. All right, that was principle 1, true choice for families. Principle 2, or value number 2, and you all know this, and I know we've got leaders across the state who've been working on this for the last few years. We have a big change in Virginia. We have a new law that says that all programs that take public dollars need to be a part of VQB5 starting next year. And by next year, I mean next summer, not in a couple of days. But we're trying to bring everybody on board this year for a practice year. But it does mean that we recognize and are having, are kind of raising the bar on what we want to see from our programs that take public dollars. We specifically look at 2 things across these classrooms. And for those of you who've been participating, and you might have known it as PDG or VQB5, you've had folks come into your infant and toddler, mixed age and preschool classrooms, provide those really valuable observations. There's a lot of talk about curriculum. We've got more than 40 approved curriculum now that you can choose for your classroom, including a free or low-cost option, because we know that many childcare and family childcare programs can't afford kind of curriculum right now. But this is a big shift, right? Before, what was known as Virginia Quality was optional, and we've had a set of changes both in law and in practice across the state. That means that everybody's got to participate by the fall of 2023. It also means that the state needs to take a look at our funding rates and fund you to be able to meet these quality expectations. And that's where we get to educator compensation. When you look at that we're actually measuring, I'll take us back for a second, interactions and curriculum, there's not a lot of costs directly related to that. Yes, you need to open your classroom to your observers, participate in some of that training, but actually having somebody come in and observe your classroom doesn't necessarily have a big cost, right? Similarly, we're making sure that curriculum is affordable to you here in Virginia. So there's not a lot of kind of cost there. However, these 2 things do mean changes for your educators. It does mean that you have got to train your educators. You've got to support your educators differently. And that means in order to kind of be able to attract, support, and retain qualified and competent staff, that's where this costs more, right? Not in these explicit particular ingredients, but what it means to be successful in the system means you need to be able to pay your teachers more. We need competitive compensation, because if you're competing with Target and Walmart and Amazon, it's really impossible to hire somebody. Most of the folks I know who, when we talk about kind of teacher retention, they would prefer to work with young children, but they've got a utility bill, or they've got a sickness in their family, or they've got an emergency need that they've got to cover, and you can't afford to pay them more because you can't in turn charge those higher rates to your families. So this creates a really vicious cycle. So think back about what I said before, where we know that half of the child care programs in Virginia last year reported not making money. And we know that that's particularly pronounced for our programs that are taking child care subsidy, because we pay less than even than the market, right? That plays out in staffing. So let me explain what these charts mean. So we did a survey of programs that take the child care subsidy program entirely on private paying families, which again can afford for the most part to charge those parents more. And they're certainly charging those parents more than what the state is paying. But because, or likely, as a result of the state underpaying per child, we see pronounced differences in our programs that take public dollars and those that don't. So we see that our educators who work on our programs that take public dollars get paid about $3 less on average, right? That also means that it's harder to hire for those positions, and you tend to have more vacancies. So in turn, our programs that participate in child care subsidy program have about twice as many vacancies as those that are taking private pay. Our hypothesis is that our programs that take private pay have been able to pass on some of the higher operating costs, right, with the social distancing and the changes in protocols onto private paying parents, right? And so they've been able to kind of make some of those adjustments as everybody else has increased wages. But our programs that take childcare subsidy, they can't charge the state more, right? The rate is the rate. We have added some flexibility on when you can adjust your rates, but it's really difficult, right? And so we think that this is evidence from Virginia that suggests unless we get rates that enable you to pay competitors, pay your staff more competitively, then you're going to continue to face real challenges in hiring staff who are going to do well, the quality expectations. And honestly, you'd say, forget even about that right now. I just need to make sure I have full staff, right? So I can take these families off the wait list and fill my classrooms. So we also know from Virginia that paying teachers even a little bit more per hour matters, right? And so I'm going to take this evidence here, right? There's a $3 difference right now between our programs that take public funds and those that don't in childcare. And that probably translates into pretty high rates of turnover, because the flip side is we did a test or measured offering a financial incentive to teachers. Some of you were part of the Preschool Development Grant, or PDG B5, a few years ago. This was when the grant was $1,500, and we were able to do a very specific measurement in Northern Virginia, and we found in a randomized controlled trial, which means it's gold standard for evidence, that offering teachers $1,500, not for a credential, not for a performance, simply to stay, and roughly that means about 75 cents an hour over the course of a year, cut teacher turnover in childcare in half. 75 cents an hour. And this was pre-pandemic. And I know that the numbers are much more challenging now, but you went from 30% turnover down to 15% turnover, right? Really significant. That's why we've continued to grow Recognize B5. It's now $2,000 per year per educator. But we also know that the state can't forever be in the business of paying teachers. And so thinking about how do we better support our leaders, our directors, our owners to offer more competitive compensation is really important. We also know that retention matters. It is not efficient to have to rehire, to do all these background checks, to do all the interviews that half the time they're not showing up for, right? To then give them the job, to then not have them show up on the first day, then have them leave after the first week, right? The dreaded Friday afternoon. Thank you, Ms. Jones. I'm out. I'll never see you again. None of this is good for business owners, for leaders, but it's also really bad for kids. If you'll remember what I said earlier, kids learn in the context of trusting relationships. And if that infant teacher changes every 6 months, it's like starting from fresh with a little one, right? We know that they learn more, and not just letters and numbers, but the social emotional skills, how to manage their own behaviors, right? A teacher who knows that toddler will pick up on the cues when Johnny is starting to get frustrated or upset, right? And help him redirect those emotions. And those relationships are what enable kids to learn and grow more. It also is logistically really challenging, right? So figuring out how we can slow the roll of turnover is really important to operate more efficiently and to make sure that kids receive the experiences that put them on track for success. All right. So with that in mind, there are key values that have led to this proposal for setting different rates for childcare and for our co-payments. Really 3 important things to remember. 1, we want true choice for families across our public-private system. We think it's really important that we have a public-private mixed delivery system and want to support all of our programs. Number 2, we need to support our programs that are willing to take public dollars, right? It's always a choice, but it's a choice, and you're serving our most vulnerable kids and families. We need to support you to meet the expectations of EQB5, or a new quality measurement and improvement system. And 3, a big piece of that, because there's not a lot of direct cost to being part of EQB5, but it is important that you have a competitive workforce, right? We have to figure out how to support you to offer more competitive compensation if you want to continue to meet those quality expectations. So we are proposing, and what the new budget requires us to do is to shift from funding based on what the parents in your community can pay to looking at the true cost. So we take a whole bunch of factors. We look at Are you a center? Are you a family day home? Your geography. So how much is the cost of living in your community? Are you for or nonprofit? Are you public or private? We look at Virginia's licensing standards, what we say about teacher-child ratios, kind of costs of materials, kind of compensation. In Virginia, again, focused on kind of some proportion of what our K-12 teachers make. And then some of the kind of key factors that go into your business, right? Sort of how your enrollment efficiency, your funding sources. Many of you know this. A lot of times your 4-year-old classrooms in your after school or summer programs support your infant toddler classrooms, which are the most expensive class. $14,000 is a lot of money for families to pay, but that's not even true cost, right? It's cross-subsidized. And so we try to factor that in. And we understand why it's so important that you have those mixed ages so that you can make the bottom line work. We then have a set of assumptions. And again, we're not going to try to get too much in the weeds here, but I want you to understand what we quote unquote baked into the model so that you understand, okay, this is what it accounts for. So we did account for geographic variations. It is more expensive to live, for instance, in Northern Virginia than in other areas of the state. We did use the Virginia licensing standards, right? Those teacher-child ratios, because we know that that's a baseline cost if you have to be licensed. And we did account for competitive compensation. So again, we'll talk in a second about what that means for you, but moving away from saying, okay, the average pay in Virginia for a childcare teacher is $12 an hour. We didn't bake that number. We baked a higher number into the model. We baked in a proportion of what your K-12 teachers make. Now, we didn't take the exact amount that the K-12 teachers in your community make because we recognize necessarily have a teacher's license or a bachelor's degree. So we discounted it. We reduced it slightly, but I think it's an important shift from thinking of this, okay, how are we sort of just minimum wage to sort of setting a benchmark, let's call it, that is proportional to what your K-12 teachers make. And then we made some assumptions about kind of capacity. This is a complicated spreadsheet. We can give folks access to that. We are not going to kind of put that up on the screen right now, probably because all of our eyes would roll back in our head. But we did want you to walk you through the different assumptions. And here's what we will do with it. So first of all, we plug in all of these numbers for all the different areas of the state, the cost of living, the K-12 teacher salaries, the different ratios, all this kind of stuff. And we use those numbers to set regional payment rates based on for the child care subsidy program, kind of a percentage of the estimated cost. So we figure out kind of what 100% of the cost should be, and then we're going to set a target. We're going to align with the federal expectation of getting to 75% of that target likely. That is what we're talking about right today. We'll talk in a little bit about kind of specifically when you should expect to see that change if all of this is approved. But that's the kind of the first step. As part of that, we are also going to publish kind of the rates that were used to calculate the compensation. So again, this is not a requirement for you to meet that compensation level. As a private entity, you still have total discretion on how you set compensation. When you say your new teachers, your veteran teachers, how you think about performance, but we want you to understand what rates were used as part of the model so that you can think about that's what we're saying is kind of competitive compensation for your area. It's completely voluntary. We just want to understand, do these rates, in fact, help us get to more competitive compensation while also giving our private businesses complete discretion on sort of setting those wages. And then after we've done those two steps, what we're going to continue to do is we'll crunch numbers again. We'll look at some of the results from VQB5 and ask ourselves the question, is there more that we need to do? So one of the things that comes up is we know that our teachers who work in schools have more time for planning and professional development than our teachers who work in childcare, right? Because you need her for every minute to be counting ratios. So she and the other teachers can't go off and do a professional learning community or professional development. So we're going to continue to measure that this year and kind of come back as we go into VQB5 to think about accounting for that. So with that, the first step that we're going to do is set these rates so that, to fund you to meet the expectations. And this will, we hope, sort of ensure that folks, as we roll out VQB5, can fully participate. And again, the goal is to get to kind of more competitive compensation. We Also know that this will mean a shift for you all, but also will have an impact for families as well as for the state. So we'll start in the middle with providers, but again, the goal here is to fund you to meet the expectation. And we are hoping that particularly for those of you that serve a large number of publicly funded programs, so you're relying on us for most of your revenue, that you'll show us how to innovate and how to kind of think competitively about compensation. I think we see that happening among our entirely privately funded programs, and we want to provide you that same opportunity. Again, we'll set kind of, here's the numbers that we use, what we think are the competitive compensation, encourage you to aim for those, but all of this is voluntary. None of this was required. We think this will be really important for families. And you might say, well, this is invisible to families, right? But we think it's important for families really for two reasons. One, we think it will make it more attractive to take childcare subsidy, and we'll have more programs that are willing to do it or do it with more kids, right? Which in turn offers more choice to families. And we think it will help us grow, right? So that as we continue to sort of fund programs, that we'll have more and more families who say, this makes sense for me. I can actually get a quality option. If you fund childcare subsidy too low, a family may opt out of it and opt out of working or going to school just because the economics don't work for them. It's just too expensive for them. If we do this for providers and for families, it's our goal, obviously, to have more kids coming to school already. We think we will have a stronger public-private system. We think we will have our childcare programs will be competitive with our Head Start and our Virginia Preschool Initiative programs. We'll recognize, so this is a shout out to all of my family day home educators out there, right, who will be able to solve some of these childcare deserts, right? We will open more family childcare homes, which can be on par with what's offered in a center or community action agency or school-based program. And we're hoping ultimately to develop a national model on a public-private parent choice system. I should note, I think it's only 3 states so far that have been approved for this alternate way of calculating rates. So really think of Virginia as a leader in figuring out how to pay all of our providers to meet quality expectations and make this more affordable for families. A few things to say about what this is not, because I'm sure there's lots of questions running through everybody's head. So we are not putting these rates out with a whole lot more requirements. We have been piloting VQB5. We had a practice year last year. We've got another practice year. VQB5 are the quality expectations, right? The measurement and the observations in your classrooms and the kind of encouraging use of curriculum. Still a choice. If you don't want to use curriculum, you don't have to use curriculum. It'll just kind of factor in your rating. But we're not changing the requirements. We're not requiring bachelor's degrees. We're not requiring teacher's licensure. We're not changing the ratio requirements. All the things I know that can be really costly that sometimes have been associated with quality measurement. VQB5 and its focus on interactions and curriculum. That is it. That is the only strings that are attached to this in addition to licensing. We are not saying how you set wages. We understand that is really important. That is a programmatic decision. How you start teachers, how you think about increases over time, how you account for different experiences, different educational backgrounds, all of that. So we are going to measure how much teachers get paid because we think we need competitive compensation in our state, and we want to make sure that we're supporting you to do that. But this is all voluntary. And ultimately, we're not trying to cap earnings for any program. It's a choice to take public dollars. It's a choice how many kids, how many on the vouchers that you want to take. And so again, we just want to be very transparent with you about these choices. What we're trying to do, if you think back to that slide that looked at the difference between our programs that take childcare subsidy and those that don't, we want to kind of create a more level playing field, right? And I think that's really important. But we don't want to be overly restrictive as well, right? We want to give you the resources and have you innovate and think about what makes most sense for your educators, your kids, and your families. All right. So change number 1, and we're going to publish these results. So these rates, rather, we will be putting out from the VDOE an entire chart that looks at like the infant rate for child day centers. There will be an overall family day home rate, right? Kind of by region, so you can look up and kind of compare it to your current rates. And we'll publish that, and that'll be out for at least a month. And you'll be able to look at that and say, okay, well, this is what it specifically means for me, for my program, for my revenues. That's That's our first proposal. Our second proposal has to do with parental co-payments. And I saw some nodding earlier, but we have had the opportunity, because of flexibility resulting from the COVID-19 pandemic, to cover the co-payments for families throughout this pandemic. But the challenge is that the federal law requires states to make families pay a co-payment. And it only allows us to waive that in certain populations, like, for instance, families underneath the poverty level. The law also says we have to reflect a sliding fee scale, and that we can do a flat rate or a percentage of family income, but we can't tie it to the rates that we've just charged. I should note in this, as we shift from talking about rates to co-payments, we also think that the paying providers more will help families with co-payments, because there's really, in practicality, two co-payments that families might be subject. There's the official one that's set by the state, and then sometimes there's the difference between what the state pays and what the provider has to charge, right? And the parent has to make up that difference, right? So by getting those rates closer to what it actually costs you to operate, hopefully gets rid of that kind of less visible co-payment. But we still have to figure out, all right, what is the official co-payment? In Virginia, we have typically found that probably in part because of how we set co-payments, that our child care subsidy program typically serves families with very low incomes. And largely because once, as you saw in that chart I presented earlier, as families started to make more, it became kind of a little bit cost prohibitive. Yes, you were eligible for the voucher, but if you had to spend $4,500, the voucher's value was probably pretty low to you. And we know that this changed pretty significantly with the pandemic, but we had a lot of families that were basically had reported income of zero, and all they were subject to was kind of the difference between what you were charging and the state amount. And then pre-pandemic, ballpark, we would kind of collect from families just about $15 million in co-payments annually across the system. So that's kind of where we started. We then had the pandemic, right? And the federal law gave us the flexibility to use some of these relief dollars to cover all of the co-payments. And we know that was huge. Particularly, we heard from areas of the state where we had families who are on the upper ends of our kind of income eligibility who are saying, I can't afford to pay $5,000 out of pocket, right? That's just not affordable when I look at the cost of living in Northern Virginia, for example. And so I'm just going to stay home, right? I'm not going to return to work. And so we recognized that was a problem. And that as a result, we start to see lots more families, including kind of our families that are still sort of income stressed, right? But kind of working and needing the support. And you'll see there's sort of the shift in time. We have far more families participating on the child care subsidy program. We went from 20,000 families last summer, to just over 30,000 last month, which is really important when you think about how we got to get our economy back and working. And all of these families are paying zero co-payments. And we have just heard from providers and families across the state how important that is. So this is the current co-payment scale. So if we were to go back to the regulation that exists, because the COVID funding is ending, we've sort of ended this space, then you see that families would be on the hook for quite a bit of money. And it would more than triple the amount of money that the state was taking in. But, and this is a really important but, we don't think the same amount of families would continue to participate because they just can't afford to shell out thousands of dollars. So we recognize, and partly why we encouraged our governors and our legislators to kind of force us to address co-payments, is we think we need to think differently about co-payments in the same way that we're thinking about rates. So here are specifically what we think we should do to the co-payments in response to that budget requirement that we make these more affordable for families. First, we think if your family income is below the poverty line, you should not have a co-payment obligation. You don't have to pay for any other program, and we have the flexibility from the federal law, so we should take advantage of that flexibility. Second, we should move away from some complicated proportion of your income at some given point in time to a simple and straightforward copayment. And we want to get to something that sort of looks similar to BPI or mixed delivery, sort of much more affordable for you and your family. So what we are proposing to do is to do a flat monthly rate per child receiving assistance. And so you would know that rate based on your income when you apply for the program or you have your redetermination, and it remains the same. So even as your income goes up, the flat copayment remains the same. It would start at 0 for families with income below the poverty guidelines and then increase as the family's income goes up. So here is a way to think about it, and kind of a simple way to think about it is there's 4 groupings. There's no copayment. There's roughly $3 per day, $6 per day, and $9 per day. Very simple, right? Which translates each month to about $60 per month, $120 per month, or $180 per month per kid. That means, and then sort of annually, what that means is 0, roughly $700, $1,400, and just over $2,100 for families at the upper end of the income. So it's not 0, right? We are required by the federal law to charge copayments again, but trying to think about kind of a simple, straightforward, affordable way to do that makes sure that Virginia is in compliance with the federal law, but also is not a cost barrier for families. And collectively, that means as a state, that still allows us to account for $16 million that we can then turn back into more slots for more kids. So again, sort of think about it for if your family is below the poverty level, there's no official copayment for that 101 to 200%, roughly $3 a day. For the 201% to 300%, roughly $6 per day. From the 301 to 85% of state median income, about $180. I'm sorry, $9 per day, but $180 a month. Not $180 a day. That would be the most expensive childcare ever, but about $9 a day. So what would this mean? And I'll talk in a minute about kind of when these things will go into effect. But the big shift here is to reduce the co-payment burdens and to separate it from what families are making. Right now, I know you've heard this from families, we've heard this from families. You get a raise at work and boom, you owe more copayment, right? I mean, it's sort of like there's this kind of this disincentive. And so by doing a flat rate based on kind of where your income is when you come in, it removes that disincentive. We also think it's just simpler for families to understand. And it means for those families who want to choose a community-based program, who need full day, full year so they can work or go to school, that it's affordable to them, right? It allows them to sort of have true choice. We also are hoping to simplify it for providers. It makes, we have lots of issues around collections and sort of some of the challenges there, and or families that opt out. We heard a lot of times, if you guys go back to the copayments that were required before the pandemic, I'm going to lose 5 families, right? And then I got to scramble and sort of find other families and all of that. So that kind of hopefully adds to some stability. And then we think this plus the higher rates coming from us will result in a more stable bottom line, particularly for our programs that are taking a lot of public dollars. And I think similar to before, helping us establish us as a national model that's affordable, simple, understandable for families while funding programs to meet the expectations set forth by our quality measurement and improvement system. All right, that is a lot of information, a lot of slides. Again, we will make all of this available, and we're also going to make sure to get these translated, at least into Spanish as well, for our listeners today who would prefer to read this and make sense of it in another language. What happens next? Let's talk a little bit about when this goes into effect. To be very clear, hear me now, this does not all go into effect on July 1st, on Friday. Okay, we've got a little bit of time here, and we are just in the engagement stage. So right now, we've, in addition to this public hearing, we've been having conversations with associations and groups, parent groups, provider groups, our family day home groups, our childcare groups, our Head Start groups across the state, sharing why we have a problem, why our childcare market is broken, what the state budget says we have to do, and these two approaches on how we propose to do this, how we propose to fund programs based on quality expectations, to achieve competitive compensation, and how to kind of create this flat rate for co-payments. We will publish the chart with the rates by the end of this week, if not early next week, and you can look at, okay, in this region with this kids, here's what this means for me. These slides, this recording, that chart will sit out for a month for public comment. So we'll go on what's called town hall, and anybody can offer public comment, make final decisions. We also, this is kind of exempt action, but we will take this to our Board of Education to kind of understand that this is happening while we are continuing to gather public comment. We will then start with a baseline childcare provider survey, trying to understand kind of what's currently going on before we make all these changes in September. Again, voluntary, but understanding how you're paying your teachers, some of the other factors, so we can better understand the impact of these changes. October 1, provided everything goes well, is when the new payment rates would go into effect. So again, we publish them end of this week, early next week. We kind of get all the public comment by August 1st. We then plug those into the system, and then you would start to see the difference, you providers, as of October 1st of 2022. Parents, we would continue to cover the co-payments, and the co-payment scale wouldn't go into effect until January 1st of 2023. And we will work very diligently. I know this has been an issue. Largely, I know some of you, and we might hear about this now. I know that because we didn't have a state budget, we couldn't let parents know that we were going to be able to continue to cover their co-payments. So there's been sort of lots of kind of questions and concerns about co-payments, but we will work in partnership with social services to let everybody know about the changes, right? The new requirements for co-payments that would go into effect and January 1st. And then come next spring, we'll start to look at, okay, what does this mean for competitive compensation, with, again, a target of, folks, if you're going to increase your compensation, to do that by March. Again, completely voluntary. And our goal would be to do another survey in the spring to understand, did providing these higher rates enable our childcare providers, our family day home educators, to pay their teachers, or in the case of family day home educators, to pay themselves more. And I should note, for our family day home educators, that you are a teacher, and so we are hoping that you will be able to pay yourself more as a result of these rates, because I also know that our family day home educators are significantly underpaid, and again, often losing money or paying money to kind of offer this business in their home. And as we go forward, we will continue to measure the effect. This is our best guess, our estimate. We've used national experts. We've tried to get, as you can see in this presentation today, lots of information from Virginia programs, from Virginia educators, from Virginia families to put together this package. But it's a new approach, right? Only 2 other states in the country are taking this approach, and so we're going to have to learn as we go, and to kind of look at how this affects our participation, how this affects competitive compensation, how this affects kind of quality measurement, and then kind of be willing to come back and take another look at these rates. I should also note, and we don't say this in the presentation today, but when we run the methodology, we will also apply what's called a hold harmless. So if for some reason your market rate is at or above what the new kind of calculated rates are, we will take whatever is higher. So kind of across the board, the goal is that nobody would sort of see a rate that is less than what you get right now, right? And the vast majority of programs will see higher per kid rates, but I do want to note that nobody should, no rate will go backwards. That's really, really important to note that. But again, we see, I think when we looked, for example, to our family day home educators, the rates that we were proposing, I think 99% of rates are going up, right? In terms of just because our family day home educators, for the most part, historically have been underpaid. In childcare, particularly when you look at after school, it kind of ranges depending on really kind of how much the families in your community could afford to pay. But again, we'll have a hold harmless. No rate will be less than what it is today. All right. So that was a lot. We started off with our vision of making sure that every child in the Commonwealth has the opportunity to come to school ready. And we know right now that 4 out of 10 kids don't. We also recognize that it takes all of us, childcare, family day homes, Head Start, early Head Start, school-based programs, early childhood special education, faith-based programs, working together to help put kids on track for success. The vast majority of our private programs who take public funds are taking funds through the Child Care Subsidy Program. And we talked in detail about the way that we currently set those rates does not set up programs for success because it's a market failure, right? And really is based on what your families can pay, not what it actually costs to offer quality. We then talk through our values about making sure there's true choice for families, funding all of our programs that choose to take public dollars to meet these quality expectations, and a real focus on competitive compensation, showing you that data from Virginia suggests that when we underpay you, that means that your teachers have to be underpaid, and that has a really negative effect on both your program and your kids because you have constant turnover or vacancies, right? Meaning that we have families that can't go to work, kids that are sitting on wait lists, and you're super stressed, right, as those leaders. And then we walk through our 2 main proposals. One is a fairly sophisticated kind of way of estimating your costs and funding you proportionally to meet those costs, while doing a hold harmless so nobody goes backwards, with really the key difference being that we want to suggest, not require, but suggest more competitive compensation for your teachers, right? And in turn kind of empower you to to be able to pay your teachers more, to think differently about that. And 2, to move to kind of a flat rate way of setting family copayments. No copayments for families that are beneath the poverty level, and either sort of roughly $3 a day, $6 a day, or $9 a day, depending on the family's income status. This is still a proposal. We're floating this in terms of public hearing today with all sorts of associations and groups and families and others for the rest of June into July. We'll publish rates next week. You'll have a month to respond if you like it, don't like it, have questions or concerns. And then we'll work with our board, our partners, both at the State Department of Social Services as well as our local departments of social services to put this in effect with payment rates to go in to effect October 1st of 2022. And after extensive communication, because we're required to by federal law, these flat rate family copayments to go into effect on January 1st of 2023. So with that, let me see, do we have any questions come in?
We do have a couple of questions about whether there will be any changes to the structure for payments, or if these are just changes to the rates at the moment.
Absolutely. So when I think of structure, this is things like, are you sort of still going to pay folks based on authorized days, right? Or you're still going to have some of those pieces. So if we think back, there's a set of things that we have to do. So we're going to add in things like more absence days, sort of to recognize that kids may have to be out more to kind of fund you more consistently. But structurally, kind of paying, only kind of paying for authorized days is going to remain the same. And so in this, we can share with you some of the changes in the regs that will go into effect based on what the state language does. But for the most part, we're kind of paying in the same way, but we're going to pay higher rates, which hopefully should be beneficial. If there is a particular structural barrier, and I know the one that has come up is the authorized days. And I think we think about situations where, mom's working an overnight shift, and she's got to kind of, that's what you're authorized for, but kid also needs access to preschool in the morning, right, to learn and to grow. And right now, our regulations don't provide a lot of flexibility there. If there are things, suggestions for us on what else we could fix, don't hesitate to let us know. We can't fix them immediately because they have to be either go through regulatory change, or the reason we're able to take action so quickly on these changes is because of what's in that state budget. But we're willing to take all suggestions and look at, should we change the regulations? Should we work with our governor or our General Assembly to think about adding that to next year's budget, for instance, so we can make some of those changes? So please, If there's a particular barrier or pain point or thing structurally that you don't like, let us know, and we'll start to look at kind of if there's ways to address that as well. Other questions that came? Excellent. At this time, then I'd like to open it up if there are questions or public comment from our folks in the audience. Okay, oh, would you mind coming up? I know. We're all, it's so awkward as we're back to in-person things. And so, we're all figuring this out as we go. So I think that, right, Ali, if you hit the button that says push, it should turn on the microphone. That way our folks at home can and our centers can hear you and homes can hear you.
Okay, how's that? It has a green light. How's that?
We have our first technical difficulty. Hold one moment. You can hear her? Okay, just kidding. We can hear you.
Okay, good. I just want to say it was very refreshing to hear all of that because I am a director at Arms of the King in Newport News, so in the Hampton Roads area. And we serve a predominantly lower income community. And we have been forced to charge an over the market rate since the pandemic and since minimum wage has been rising. And, with Virginia Quality, we're a level 5, so we're the highest level you can be. And we're one of, I believe, 2 level 5 centers in our region. And we are struggling to make ends meet and pay our staff the way that they need to be paid. And then, on the other side of the coin, our waiting list is nearing 200 families. So the biggest challenge for us has been trying to walk that line of providing that quality care, having a safe building for the kids, qualified staff, and not, ripping the parents off, making them feel like they're being ripped off by, passing off that extra charge. And the co-payment relief program has been great, but I will say that really helps the parents more than it helps us. So, that hasn't really, I haven't seen a huge difference as an administrator from that, but the parents are very thankful for it. And so I just wanted to really, really emphasize the need for those higher rates, especially as inflation is rising. And we're basically already in a recession. We partner very closely with our families. So I've been hearing a lot from these families that they're concerned about if they can't afford childcare. Obviously, they're not going to be able to keep working, and that's going to just drive their recession forward. So it's very refreshing to hear that. I think what all of us as administrators and teachers and childcare providers have been saying has trickled down to the right people, or trickled up rather, I guess. But one thing I'll say, as you were speaking about the payment structure versus the payment amounts, I really would love to see the payment structure change to enrollment based as opposed to authorized days based, because those parents are busy, and we are not allowed to help them swipe, but a lot of times they're just not swiping. So I know for a fact, like, we're being underpaid because of that specific issue. So that's really the biggest thing. But I also wanted to say thank you for, bringing all of this up today, because it is so important. I don't think people really realize that childcare is part of the backbone of our economy and society. So I just wanted to say thank you. And I'm very hopeful that when all of this goes into effect, we'll see hopefully some immediate relief as well as long-term.
Absolutely. Thank you. Would you mind saying your name and saying your center's name again?
Yeah, sure. My name's Audrey Livingstone, and I'm from Arms of the King Child Care Center in Newport News.
Wonderful. Thank you, Ms. Livingston. Very important points, I think, in recognizing the stresses that programs have experienced. We never closed childcare in Virginia during the pandemic. We know that 90% of our family childcare remained open every single day of the pandemic. And not only is childcare generally the backbone of the economy, but you absolutely were able to keep the economy running right during some of the most challenging days of the pandemic. And to hear of all of that, as well as your efforts to improve quality, is really important and inspiring. And I think we want to get the rates right so you can be successful, right? And so I appreciate that feedback. I think as we've been having these conversations with folks, this is really important information for us about there's still this structural issue and there's still that structural issue. And all of this is great advocacy, right? As we start to think about how do we structure you to be effective. I've often said this, not only does childcare make the most of every dollar, but you're also incredibly willing to be accountable, right? You've got families coming day in, day out, you've got all sorts of, folks opting into quality measurement, like under Virginia Quality, or, as we've seen in the last year. Last year alone, Virginia did 10,000 class observations. That's up from a few hundred, 3 or 4 years ago. That means that across the state, childcare programs as well as family day home programs are opening their doors and willing to be, accountable for health, safety, and quality expectations. And now it's really incumbent upon the state to, to fund you fairly to meet those expectations, so that in turn you can pay your teachers what they deserve to be paid. There's, our early childhood educators are our heroes. But we need to make sure that we put our money where our hearts are. And that's really, really important. Thank you so much.
Jenna, do you want to speak about, so I think Ms. Livingstone raised the issue of, not wanting to raise rates and pass those increased rates on to parents. One of the things that we really want to make sure that we're avoiding in the context of increasing payment rates at this, from the state, public payment rates, is that we're not unintentionally or driving or incentivizing providers to increase their private pay rates beyond what families in the community can afford. And so we've talked a little bit about providing some technical assistance to ensure.
Yes. So we've gotten the question, well, if I happen to be in a community that can't afford to pay much more, and you all run your cost estimation model and you come up with a rate, you're going to pay me at a rate that is higher than what I currently charge my private paying parents. Does that mean I have to charge them more? Because that also could be really, really problematic for those families. So the federal law actually provides flexibility. Many programs don't necessarily know about this, but if you happen to be in the situation when these rates come out and you look at the chart and you look at your community and you look at the ages and you see that the rate that we're willing to pay you is higher than what you currently charge, that's okay. Because what the federal law says, if you use a cost methodology, which is basically what we've walked you through for the last hour or so, if you use that type of approach, it's okay to charge the government more than what you charge your private paying parents. And in other words, you don't have to turn around and charge your private paying parents more if they can't afford to pay more, right? And so I think that's really important to note. We will provide additional technical assistance on that, but I don't want anybody in the room or at home or in their centers today to feel like, wow, this is great for my kids who are participating in child care subsidy, but for my other families, they can't afford to pay more. This does not need to affect the rates that you charge your private paying parents. And what we will do is we will work with you to make sure that you charge us the maximum rate, right? Because that's the cost of quality, and that doesn't necessarily affect your private payments. And we'll work with our partners at social services and vendor relations as you sort of think about how to fill out that form and how do I do this. But that's a really important part of the federal law that not many states or not many programs know about it. Part of why you don't hear more about it is because only 3 states have taken this approach, right? So if before we crunched all these numbers on your behalf, you would have had to do that in order to demonstrate. And that's a really big lift for a program to kind of have to go out there and look at the Bureau of Labor Statistics and run all these numbers and do all of this. But because Virginia has done this for every single region of the state at every age level, we've done the kind of the hard work here, and what we'll do is support you if you want to charge the child care subsidy program kind of to take that maximum rate, and you might need to have like a lower rate for your private pay families. So
When will childcare providers be able to see what the new kind of payment scale will be based on region?
yeah, so we're hoping to get that out no later than next Tuesday. Yeah. Crunching some fat on them. Doesn't go into effect. And so basically we've got today's session. We will post, we'll figure out how to post online as well as sort of via Readiness Connections. Here's how you offer us public comment, but this isn't the end of, this is almost strange because sometimes the public hearing is the end of the public comment. It's the opposite here. So really the next month, this was the philosophy and the approach. We'll publish those. And again, we'll encourage you to write in if you have questions or concerns, or there's other recommendations that you have for us, but those will be posted for at least a month. And we wrap this up on August 1st. Then we program it into the system. We communicate it very broadly and goes into effect the payment rates October 1st, the co-payment changes January 1st. Great question.
I would also, so we hear about the challenges with the swipe card system frequently, and just want to acknowledge that is something that we're looking into making some shifts around. So we want to continue to get data on attendance because we think it's incredibly important to know how often children are receiving care. If not, explicitly for, payment purposes, certainly for understanding the impact or the benefit, right? We know kids have to be there in order to benefit from high quality care. But that said, we also recognize that the current system is burdensome and challenging, unnecessarily so. And so we want to look to shift to a different model for collecting attendance and tracking it and trying to make it so that it is pretty seamless with the attendance tracking you're already doing. And so we are looking to make some of those systematic changes. It's not a particularly exciting thing to share in a public engagement session because we're not quite there yet to have any next steps to really share. But just want to acknowledge that we know that's a pain point. We are looking into some solutions and hope to have kind of new technology to roll out that is less kind of parent driven and more provider driven in the next couple of years. So.
I know. Absolutely. Excellent. Well, thank you again for folks in the audience. Any last takers on public comment? You don't have to, totally optional. And for everybody listening in, all of our family childcare educators, everybody who is Zooming in or live streaming in our childcare centers. I imagine kids are beginning to wake up from nap and activity is flurried again, but really important information that we wanted to walk you through. We put all this on the website. This is a plug. If you do not receive Readiness Connections, which is our weekly newsletter that goes out on Tuesday, please go to the VDOE website. You can Google VDOE, early childhood, plug in, you enter your email address and it comes every week. The important information, we're sending it out. We try to only put out stuff that's relevant for you. Right now we have about 12,000 individuals across the state that get that information, but this is a lot of change. I was talking with some of my colleagues earlier about just how much change it is, and it can be hard to keep track of it, and we understand that. We think this is really good change, so we hope you will support it, but make sure that you sign up for that newsletter to keep abreast of what's going on. You can always email us at earlychildhood, one word, at doe.virginia.gov, and again, we will publish these rates. We've got a month to take in public comment, and if you like what you see, please let us know that, but also let your elected officials know this. I can't say this enough. Partly we're able to take this type of important action because of our senators and delegates and our governor who put this into the budget to help it happen because they understand how important childcare is in Virginia. So please, please, please continue to reach out and let them know that you're excited about this. I would also encourage them, to help them understand how many families remain in need. I think most recently, our current governor, Governor Youngkin, had the opportunity in recognition of Child Care Educator Day to visit a center nearby and was struck as he walked through this wonderful center with incredible interactions and lots of energy. And he said, why are there empty classrooms? Like, why in the world, if you figure this out, you have empty classrooms? And then, the director and owner let him know, and I've got kids on a wait list. Like, how in the world do you have a situation where you have empty classrooms and kids on a wait list? But he said it was staff, right? I can't afford to kind of get more staff. I'm struggling to attract staff and retain staff, largely because I'm competing with big companies that have dramatically increased their compensation and benefit packages over the course of the last 2 years. But that was really powerful for our governor to see that. And I would encourage you, if you do have relationships or you can reach out to your elected officials, helping them understand that in an area, right, particularly where you've got lots of military and our national security is at stake, you've got 200 families on a wait list, 200 kids and families on a wait list. They're not working or going to school if they're sitting on a wait list, right? It's a lost opportunity for all of us. So you all are the backbone. You are educating the leaders of tomorrow while supporting the workers of today. And the more that we can collectively work to get the word out, to be able to demonstrate the return on this really important investment, the better off we will be and the better off Virginia kids will be. So thank you. Please don't hesitate to reach out if there's questions or concerns, and look for those rates to be published next week. Thank you all. Take care.